Good evening, everyone. My name is Dr. Ashley Tucker. I will be your moderator for this evening, and welcome to the Scleral Lens Education Society's February webinar. I'm so excited to introduce my friend and colleague, Dr. Karen DeLoss. She will be giving us a wonderful webinar on the Global Specialty Lens Symposium 2024 highlights. So just a couple housekeeping things. So please remember that you must remain online for a minimum of 50 minutes for COPE credit. Attendees are welcome but not obligated to stay for Q&A at the end. Course handouts will be found on the SLS website library page later on this week. We welcome any questions. Please feel free to put them in the Q&A feature at the bottom or the chat feature. I will be checking them at the end of the webinar. This is new if you have not joined us recently for SLS webinars. We will need you to download the OE Tracker app in the Apple App Store or Google Play Store. After the CE session, you will need to open the app, verify that your personal information is correct, then scan the QR code with your camera, and then a confirmation will appear if you correctly scan the QR code. You have to open the app to scan the code. So make sure you do that and not just scan it with just your camera. It's okay if you can't get the app to work. CE certificates will be still emailed about 2 weeks after the webinar. So I'm excited again to welcome Dr. Karen DeLoss. Dr. DeLoss is a graduate of the Illinois College of Optometry in Chicago, Illinois. She went on to complete a fellowship in the cornea and contact lens area at the University of Houston College of Optometry, and also completed a clinical fellowship at the Boston Foundation for Sight in Needham, Massachusetts. Dr. DeLoss is a fellow of the American Academy of Optometry and a fellow of the Scleral Lens Education Society. She lectures both nationally and internationally on subjects related to her clinical practice and research. Just a few more things about Dr. DeLoss. She's an assistant professor at the University of Michigan, Kellogg Eye Center, Department of Ophthalmology in Ann Arbor, Michigan. Her practice primarily concentrates on specialty contact lenses for corneal ectasia and ocular surface disease. She also serves on the AOA, CLCS Council and is the vice chair of the Global Specialty Lens Symposium. She is also an advisory board member of the GPLI and an advisory member of the Scleral Lens Research Meeting. She has published in American Journal of Ophthalmology, Contact Lens and Anterior Eye, and Eye and Contact Lens and Cornea. Welcome, Dr. DeLoss. And I'm going to unshare.
All right. Thank you, Ashley, for that lovely introduction. I appreciate it. I'm just going to start sharing my screen. It's not sharing. Ruh-roh. It's not sharing. Let's try it again. There we go. Sorry about that, everybody. All right. So thank you so much for having me. I found this lecture really hard to put together. I've lectured a lot, but I'm actually doing a synopsis of everyone else's lecture. So bear with me. I tried to do my best to shed light on topics and do some justice to the speakers. So I have nothing to disclose. The GSLS, for many of you who already know, it's been going on for over 10 years. It's changed names. We offer 9 hours of general sessions and up to 21 hours of continuing education. And this year we also had 4 interactive workshops. We had 924 registered attendees. We had 224 international attendees and represented 38 countries. So these are the demographics of where folks were coming from this year, and you can see that the majority are from the United States and Canada, but we also had people throughout the world, including China, Taiwan, and the UK. So I am going to do something different, and I am going to switch over. Oops. Share screen. So I want to know where you guys are coming from tonight. So if you can just hit that QR code, it's going to prompt you to go to, it should pull up menti.com. So we'll wait a couple minutes and see. I'm hoping it works. Oh, Philippines, you're the first one. That's quite far. So thank you so much. Boston. There's more. There's got to be a few more. Canada, New Jersey. That's awesome. Columbus, Michigan. I love it. I love it. Montana. All right. Oh my gosh, you guys are fired up tonight. I love it. Shanghai. Wow. California, Kansas City, LA, Montclair. Keep them coming, guys. This is amazing. Fun. All right, well, we have to get to the lecture, so I'm going to switch it back over to my lecture. So, let's go back. Share that one. All right. So thanks, guys, for partaking in that. That was fun. We had 2 awards this year. We always like to honor those who have dedicated a lot to our profession and demonstrated excellence. This year's Rising Star Award went to Kevin Chan, who many of you know has done a lot of work in the area of myopia management. And our award of excellence, which we've been giving out for well over 10 years, went to Dr. Jan Bergwinson, who was my mentor at the University of Houston. And so you can see Dr. Nichols giving him the award. It was really fun. It's always fun to see, someone that kind of brought you into the circle who's actually getting honored. So that was a wonderful time. So this year was the first time we actually had a keynote lecturer, Dr. Nathan Efron from Queensland University of Technology in Australia. And his lecture was titled Whether Contact Lens Wear is Inflammatory, Implications of Specialty Lens Fitting. This was hands down my favorite lecture that I've seen at GSLS. He mainly focused on the 4 tenets of inflammation, that being rubor, calor, tumor, dolor, and then a bonus one, functio lese. I'm probably not pronouncing that right. And this goes all the way back to the Roman 30 BC to 45 AD. The functio lese comes from the Greek times, and that was a little bit later, and I'll go through all of those in just a second. So Dr. Efron, he's a well-published researcher, gave a lot of good evidence to say that contact lenses do produce some inflammation. So rubor, that first tenet of inflammation, redness, we all know that hydrogels caused a lot of redness and also SiHys. He definitely demonstrated that there's many publications on this. Calor, meaning heat. Through thermography, he demonstrated several papers that showed that contact lens wears actually heats up the eye by 2 degrees Celsius. Tumor, meaning swelling. So, for a long time with PMMAs and hydrogel lenses, we had corneal swelling. So we still have a concern about that under scleral lens as well. Dolor, pain. So not necessarily pain, but dryness. We know that patients commonly drop out of contact lenses, not necessarily scleral lenses, but drop out of contact lenses due to dryness. And then loss of function, he equated that with contact lens discontinuation, which of course we know that a lot of patients drop out because of the dryness. He also cited the subclinical indicators, that being cellular reactions, notably that Langerhans cells actually increase, and then biochemical reactions of an increase in inflammatory mediators. And these are not necessarily bad things. These can be protective ways that the eye combats protecting itself. So he really did a wonderful presentation, and I've hopefully summed it up beautifully in 2 slides. We also had a new style this year where we did a debate with Dr. Bennett and Dr. Efron called the Great Debate. And we did a debate of whether soft lenses versus GP lenses. The debate topics included that GPs are nearly extinct. Gas permeable lenses should only be taught at the postgraduate level. Gas permeable options are healthier or safer compared to soft lenses. Orthokeratology is not worth the effort, and gas-permeable lenses provide better vision and more refractive options. So the style is that one would go first, and then there was a counter, and then they each got 2 minutes. So the first debate topic, Dr. Efron wrote an obituary to the rigid contact lens in 2010. He said that we would not be fitting any type of rigid gas permeable lens anymore. And he cited several publications, starting in 1970 all the way to 2010. And you can see that there's just a gradual decline in GP fitting. But however, you're all a part of the scleral lens education webinar. Well, we know that scleral lenses have been taking off more and more over the last decade or so. So right when Dr. Efron was saying no more GP materials, Dr. Bennett was able to counter and say, look, we've got a new era here, and we've got a huge influx of GP and scleral lens specifically fitters out there. So debate topic number 2, that gas permeable fittings should be taught only at the postgraduate level. This one was kind of interesting, and I'm sure some of you who are listening beyond the US and Canada have a different type of training program. But Dr. Efron cited that many training programs have less education overall in optometry schools dedicated to GP fitting, and that there's a big draw as part of the residencies as advertisement or education on getting residents because they can have additional training. But Dr. Bennett cited that that's not necessarily true, and that's not necessarily going to fit our patients. And the people sitting in the audience there he kind of cited as being really wonderful fitters that are completely capable and did not receive any postgraduate training. Debate topic 3, gas permeable options are healthier and safer. This one was tough to argue because we know that GP lenses are a much safer option compared to soft lenses and have less incidence of microbial keratitis. And also we know that they're going to have a less incidence of keratitis. So unfortunately, Dr. Efron didn't have much to stand on with that one. Debate topic 4, orthokeratology is not worth the effort. Dr. Efron citing again that it's painful during waking hours, which of course you're not wearing them during waking hours. The process can be difficult and time consuming. They're expensive for patients. Orthokeratology is only capable of resolving 2 diopters of myopia, and it's quite a poor alternative to soft contact lenses. Naturally, Dr. Bennett came back and said, there are many studies confirming the efficacy of orthokeratology and that we can indeed help patients, that we can obtain an improvement of 4 to 5 diopters. If you improve the fit, you'll improve the comfort. There's many studies that show that there's minimal risk and a huge improvement in the quality of life. And orthokeratology fittings are on the rise throughout the world. Debate topic number 5, I don't think there's much again here, but GP materials certainly provide better visual outcomes for example, for keratoconus, ocular surface disease, and presbyopia. Dr. Efron then countered that, obviously soft lenses are more readily available, but again, I got to give it to Dr. Bennett for really holding his own on this one. So our next general session, again, I'm going to mainly cover the general sessions. We did a unique one where we talked about keratoconus, past research and clinical indications for the future. And in this session, we had Dr. Loretta Schatzka-Flynn, Dr. Jan Bergmanson, and Marta Aminez Garcia out of Spain, and Dr. Sensino in Tennessee. So for this one, Dr. Schatzka led it off and said, where are we at with the research? Well, obviously better detection methods have increased the capability of diagnosing keratoconus. So we traditionally thought of keratoconus as 1 in 2,000. However, present studies are showing that it's somewhere between 1 in 375 or higher which is a 5 or 10-fold study increase. She also cited, also looked at the CLEX study, the Collaborative Longitudinal Evolution of Keratoconus study. And if you haven't been exposed to this, it's a wonderful study. I just wanted to give a shout out. It's the 20th anniversary. So this study was 1,209 patients enrolled between over an 8-year multi-center study. There was actually 15 clinics involved. I think it's one of the largest, it is the largest keratoconus study to date, and there were several publications that came out of it. The last patient was seen in 2003. And there's a huge number of study findings. I can't even begin to summarize it, but one of the key findings was that if you're less than 17 years old and diagnosed with keratoconus and you're 55 diopters or more, you're at a high risk for progression of 1.5 diopters or more within 12 months. And the younger you're diagnosed, the more likely you are to progress. Obviously, fast forward to the future, what changes have taken place since that study was first published? We are fitting less GP lenses, but more scleral lens patients, scleral lens fits, and also less corneal transplants. Another thing that was highlighted out of that study was the familial occurrence and the genetics. Although there's not a single gene that's linked to keratoconus, there's several. If you have a family member that has keratoconus, you're at a higher risk, of course. And then she also looked at other associated genetic disorders with keratoconus. So Dr. Marta Jimenez Garcia out of Spain just published an amazing she actually did her PhD in this category, this topic. And so there, we kind of agree with keratoconus and what constitutes progression, but her argument is that we need a better method. She cited that progression can be variable. So if you're a lesser keratoconus versus a steeper keratoconus, your progression rate is completely different. The definition of progression is limited, and the reason that it's limited is it's a variability amongst the image capture. Again, if you have more severe disease, you're going to yield worse outcomes in terms of your image quality. And then she also mentioned that we definitely need, of course, future studies with the stratified effort, because you can't just look at all of the current data points that we're looking at. She suggests that we need to have more stratified approach. And she also proposed that maybe we'll be using AI for detection and characterization of the disease. So this is the paper that she and Dr. Karina Kuppen just published in Eye and Contact Lens, if you do want to check it out, that goes into detail regarding her work and that theory. Dr. Cincino did a wonderful presentation on keratoconus technology. I think with a lot of things, we were initially doing a lot of diagnostic fitting. And then we've kind of evolved into more topography-based and scleral topography-based fitting. We know that the sclera is not rotationally symmetric, and then the use and advent of OCT within fitting has allowed us to have better on-eye assessment. We know that scleral lens technology is rapidly evolving, such as wavefront guided technology. The materials also continue to evolve. And cross-linking has definitely changed the game. He's moved the goalpost in a lot of ways in terms of how we can manage these patients. And finally, with this session, Dr. Jan Bergmanson, who does a lot of research in keratoconus, talked about when we should be thinking about keratoconus or cross-linking in our pediatric patients. He mentioned that the dose of radiation is 5.4 joules per centimeter. And so do we want to expose a growing eye to this? This is, essentially quote unquote radiation. He cited that the human cornea is fully developed at age 2. I certainly do not remember that from board, so that was good to know. But his main take-home point was that you want to limit cross-linking until you definitely have known progression. The next session, we had the lovely Dr. Gloria Chu, who's a good friend of mine, was moderating this session. The title was Using Technology to Maintain Ocular Health in Scleral Lens Wear. We also had Dr. Mile Brujic, Greg Denaire, and again, Dr. Bergmanson welcoming him back. So for Dr. Chu, she really honed in on the fact that we really need to understand the process itself. So it's when we're fitting scleral lenses, it's patient dependent. So we can't just have one size fits all approach. It's disease specific, and our lenses, of course, need to be customized to the patient. She talked about a lot of the, considerations when she's fitting, and what constitutes a successful fit, such as ocular shape as well as the condition. And she also talked about lens channels that she's incorporating into her lenses and notches, and those types of things in terms of the technology and how things are changing. One thing that I really liked about this lecture is, when you're doing a scleral lens fit, you're not just doing it, when you're doing imaging, you're capturing a moment in time. So you may be capturing that image at the beginning of the disease process or late at the end, and you have to take that into consideration when you're doing the fitting. It's really important for the clinician to know how the disease changes over time, what happens in terms of the disease process to the surface and the conjunctiva, and also factor in that the lens is going to settle over time. Systemic changes really impact the fitting relationship. So if someone has a flare of GVHD or rheumatoid arthritis, their systemic health can impact the eye. And those are things that we really need to be aware of as scleral lens fitters. And she's got some great pictures to your right showing that, you've got keratinization of, I'm assuming this is an SJS eye. So again, this could be the same eye, but this could be 10 years apart. And so we need to be aware that you're not just fitting one time, you're actually fitting for the lifetime of that patient. And she brought up a really good point that AI cannot compete with the collective knowledge. And I thought this was wonderful because we kind of are programmed to think that maybe AI is going to take over everything. But she's right. I mean, AI can't think to the level that we can. Dr. Denaire also talked about the advancements in scleral lens technology, and he really concentrated on the three major ones, such as wetting ability, corneal edema, and then the common things that we encounter, such as midday fogging. So he touched on the current GP materials, the surface treatments, soft lens uses with scleral lenses, and I'll talk more about that later, filling solutions and scleral lens shape and design. So for this, he actually, brought up a good point, which is wetting angle, or how the surface interacts with the surface of the lens, surface of the eye interacts with the surface of the lens. And I haven't really thought about this for a long time, but he brings up a really good point that the manufacturers are really working on trying to help the lens, how it integrates onto the eye. Polymer changes, so coatings and how they can influence visual outcomes, such as the higher order aberrations with both wavefront guided lenses and also conventional scleral lenses. And then finally, he brought up materials. We're kind of at an impasse in terms of the amount of decay that we can do with the lenses, but perhaps improving wetability, making the lenses deposit resistance, and improving durability are areas that might be future areas that we want to focus on. And then finally, Dr. Brujic talked about the impact of OCT on particularly scleral lens fitting and how you can visualize these areas to see whether you need to troubleshoot. And he had a lot of wonderful pictures to show that we can actually isolate an area to see how we need to troubleshoot. So for example, the top picture is showing the landing zone where it's actually, we can see that we're cutting off the circulation there. And then with OCT, we can visualize where it's actually impacting onto the sclera and maybe do some adjustments. So you're kind of combining technology with your slit lamp evaluation. Another area that I think is going to be popular is looking at the blood flow under a scleral lens, and he's actually showed how the OCT has a component that you can use to visualize this. And I think this is going to be a new area that we can look forward to more research coming from moving forward. And then finally, I said finally with Dr. Bujic, but I forgot about poor Dr. Bergmanson. He talked about scleral lenses and IOP, and this has been an area of controversy. He cited many of the studies of showing IOP and what's been published. He definitely, as an educator, brought up a very good point, which is that the aqueous actually has 6 ways of outflow. So while many of these papers and publications are concerned about glaucoma, he kind of gave the argument that that the eye itself under a scleral lens is potentially capable of figuring out a new pathway. So if one door is closed, it opens up another. The other part that he brought up is that many of the ways that we measure IOP are calibrated based on the cornea, but we're actually not necessarily, those studies aren't necessarily using the cornea as its metric. So again, more research needed, but definitely some food for thought there. This another general session that we did was insights into the contact lens industry. Dr. Tucker was on that one, and it was a panel discussion on the ethics and how the Food and Drug Administration actually works. So the components of this general session were they had some great topics on ethics, whether we need and how we need to use informed consent. Adverse reporting, we heard a lot about that with the recent news of the artificial tears and issues with those, and then also off-label use. And this one, I have to say, it was just way above my head. I really think that this would be something that I would like to listen to again. But take-home points from that. Dr. Katie Spear went over what is informed consent. Well, she said it's a process. You have to explain the risks and benefits, that the patient has time to ask questions. They have to give informed consent. Who gives informed consent? Meaning, is it the parent? Is it the actual patient? Is it a caregiver? So, and that you need to give informed consent in writing. And then the other parts of it were talking about the FDA. MedWatch is the FDA-informed program for reporting adverse events. And so you as clinicians, if you're in the US at least, can go on to this website and report a problem. I was actually on the website today. So this is an area where you can click on it if you're concerned about safety for your patients. And then this is the FDA Adverse Event Reporting System. It's a public dashboard. I was on this today. It's a little bit of a clunky system, but you are able to go in and find out what's going on with any medication or anything that patients would use. So it's kind of an interesting website. I'd encourage you to check it out. Posters are some of my favorites. We get so many. You can see all these smiling faces as pictures of a couple people. We had 140 submissions that were accepted this year. The topics were on various things such as scleral lenses, of course, myopia management, corneal gas permeable lenses, higher order aberrations, etc. We always give prizes based on 3 categories: research, clinical, and residence. They are available online if any of you do want to check those out. And this year we had, this is the second year we did a rapid fire poster session. So we took the top 8 posters or 10 posters, and those folks all had an opportunity to get up stage, and they were given 3 or 4 minutes to really whip through their case. But it's such an exciting opportunity to get speakers up there, and it's really well received. So I was happy to see that we brought that back again. We also this year, we have so many submissions, and I'll tell you at the end how if you're interested in speaking or getting involved with GSLS, how you can do that. But this year we had a new session where we did a rapid fire. Because we get so many submissions, we cannot, we can't have everybody speak. So we picked 5 folks that had kind of more narrow topics, such as surgical, like sutures, OCP, pediatric management, scleral lenses in specialty lenses in special populations. And everyone did a wonderful job. They stuck to the point. They did 8 minutes and just really nailed the landing on all of those. So that was another fun one that I was able to moderate. We also traditionally always highlight 5. We always have peer-reviewed paper submissions. And so we had 5 papers this year. In the interest of time, I'm just going to let you take a peek at what ones were up there. But these are papers that are manuscripts that are going for publication, where folks get an opportunity to highlight what they've been working on and the results of their studies. So workshops this year, we've been doing workshops at GSLS now for probably 3 or 4 years, I think. And they're usually 2-hour sessions on various topics. They're not necessarily what optometry thinks of as workshops, where we don't necessarily always have equipment in all of them, but the general design of them is to be more interactive for people to come in and feel more comfortable and more intimate, where they can ask questions and be involved in some of the banter back and forth, but also the decision. So what would you do? So we had 4 workshops, as I mentioned, the imaging workshop where we brought in lots of equipment and folks were able to go to different stations and actually have a live view of how some of this equipment worked. We had an orthokeratology workshop, which the presenters were live on stage, but really wanted all the audience to participate. What would you do? What do you think about this process? Of course, the Scleral Lens Education Society had a workshop, and then we had a wonderful scleral lens troubleshooting in Spanish. It was in English and Spanish, and it was such a great opportunity for folks that come from South America or Spanish-speaking countries to be able to learn and not have to work so hard to not only take in the information, but think almost double in English and Spanish. So the workshop was both Spanish and English, and they had subtitles for people so they could follow on. The room was packed. It was great. Of course, I'm going to feature these lovely folks here. So your Scleral Lens Education Society board members did scleral lens troubleshooting, a case-based walkthrough of the scleral lens fitting process. It was case-based with polls. Of course, they went over what is the ideal fit, considerations. So, what do you think about this particular patient and demographics? They're older, they're younger, the underlying condition, the shape of the cornea. What would you do? Common problems that we encounter with those types of fits, such as blanching and patient complaints even. So what I really liked about this is they actually did a couple where the patient would come back with things that you don't always think about. You're so technically driven, but when the patients come back and say, "Doc, I'm feeling dry on my lens," which is counterintuitive to a scleral lens, what do you do? And they did polls for these. So what would you do next? So it was really an opportunity to get, roll up your sleeves and get involved. So if you haven't been to GSLS in the past, we offer general sessions. We offered 9 of those, and those are one large room. And I think the room holds about 1,200 people. But we also offer several small courses or small breakout sessions where folks you can pick what classes you want to go to. And so this is an opportunity to have, really kind of pick your own, choose your own adventures in terms of what you want to do, but on a smaller scale. We offered 18 breakout sessions this year. The topics were a wide variety: myopia management, keratoconus, scleral lenses troubleshooting, and also practice management. We had 3 sessions, actually, I think it's 4 that we repeated this year. So, sometimes you have 6 courses that you want to go to, and you obviously can't go to all of them. So we piloted repeating a couple of these, and it was really well accepted. It was wonderful to see that. We had 2 master classes this year. So we had master classes, meaning these are meant to be more of an introductory, skill building class where folks who maybe are new to scleral lenses or new to myopia management, they want to get their feet wet. So we offer these classes so that, we have an opportunity to serve everyone and anyone that's coming. We don't want to isolate anyone. We really want to have the GSLS be all-encompassing, where if you have never fit before, you can learn things. If you've been fitting for 20 years, we're hopeful that you can learn something as well. So the first master class that I mentioned, we had Dr. Dottie Fidel and Dr. Melissa Barnett. And they actually highlighted scleral lenses, of course, but then they offered a lot of education and background on atypical scleral lens fitting techniques, such as piggyback. So traditional piggyback, where you've got the soft lens underneath, but also reverse piggyback, where you're putting a soft lens over the scleral lens to help with debris. They brought up the topic of oblate designs to help with high myopia and compensation for higher order operations. One thing that they went through, which I think is really unique, is prism and incorporating prism into into scleral lenses, both horizontal and vertical. Using scleral lenses for ptosis, so to prop up those like ophthalmic lids. And then also optic decentration so that you can optimize vision for wavefront and multifocal options. So these are just a few photos that Dottie and Melissa provided me. We've got a pupil blocking lens. We've also got the left-hand corner is a prism lens. In the middle there, we've got decentered optics where you're actually moving. You can see that the line of sight does not line up with the central part of the contact lenses, so how you can move or shift that over. And then oblate designs, like I mentioned. So sometimes if your patient is high myope, you try an oblate design and you apply the SAM and FAP rules so that you can reduce some of the myopia. And then also a lot of times that will help with aberration control as well. So innovations in contact lens, this was highly attended session with Dr. Dave Kading, where we are with AI and where we're going. So AI, of course, has the potential to revolutionize healthcare, improving diagnostics and treatment, enhancing patient outcomes, potentially reducing costs and increasing access to care. Some of the current ways that we use AI, we don't traditionally think of it as AI, but contact lens design and manufacturing. Patient education is another option, telehealth, and electronic health records. Obviously, there's pros and cons with this. So pros would be we're going to improve diagnosis, personalized care, have patient-centered outcomes, and integrate technology. The cons, of course, we're going to have good and bad with everything. Patient data safety is a huge area of concern where you've got cloud-based storage and potential hacker issues and security issues. The question of whether we would be completely dependent on AI, we can trust a computer so far, but what do you do when that system fails you? And then there's also ethical considerations. So I'm sure we're going to be hearing more about this in the future. Dr. Hamadi and Morrison talked about, those patients from their title was From the Trenches, Advanced Scleral Lens Fitting Techniques for Specialty Lenses. And they really did a deep dive on what to do when you've got you're just kind of lost with some of these patients. You're honing in on one thing and you're not thinking globally. And how can we reconcile those issues? And they did a wonderful job on this one. Dr. Chu again was back with practice pearls to optimize keratoconus for patients and practitioners. This was truly a deep dive. I have been practicing for over 15 years, and I think I took a lot of take-home points for this one. She brought up a pearls, follow the clues when your patient's not 20/20, when you have poor endpoints, and how to kind of start thinking of whether your patient has keratoconus. Patient symptoms such as glare at night and starburst. She went through how to think about keratoconus progression. The other side of the coin is that she really honed in on the importance of how do you go about managing these patients. So an initial consultation, education on family, kind of taking in what the patient is thinking, offering up resources, and then discussing other things with the patient that we often forget about, such as eye rubbing, treatment for allergies, asking about family history. I mentioned that incidence has been going with our diagnostic ability. The family history is going to be more and more important. Dr. Nguyen had a lovely session on specialty contact lenses. She talked about some of the challenges with our pediatric patients, patient concerns, how to navigate parental concerns, hurdles of pediatric patients, the obstacles of training those folks on insertion and removal, or potentially the parents or caregivers. And then she went through cases. So how do you work with an adolescent patient? How do you use contact lenses for amblyopic treatment? And then aphakia, which we tend to think that's a simple one. You just do a high plus lens, but those patients frequently have comorbidities such as esotropia, glaucoma. And so how do you combat kind of that full picture of how to take care of those patients? So my colleagues here at the University of Michigan had a lovely presentation on low vision. Again, this is something that we don't often think about, but you sometimes need a contact lens to maximize the vision. But the reason that you need that is because you need the maximal vision so that you can start calculating your low vision adapted devices. So their goals are, as I mentioned, to optimize vision, sometimes glare control, and to improve the functional goals of the patient. They went through a series of cases for irregular cornea, ocular albinism, and mydriasis, and achromatopsia. And another session we had was Dr. Powell and Dr. Barnett coming back to talk about scleral multifocals. I personally have been a little bit intimidated with scleral multifocals, and with this lecture, I was like, I don't think it's as difficult as I was, imagining in my head. And they talked about the benefits where you've got the best of both worlds. You've got a scleral lens benefit for patients who have dry eye, but also those patients who are presbyopic. They're going to hopefully end up happy because you're killing two birds with one stone. They went through the lens designs and what's currently on the market, and also the fitting steps. And lo and behold, the optics of these lenses are very similar to soft lenses, where you have aspheric and concentric designs. One thing that they brought up is, the tips for the fitting, but also that the really important thing is to talk to your lab. What are the costs of the lenses? What are the warranties? How many redos can you make? And I thought that was a great pearl that I wanted to share with you. So future topics for GSLS. We went through and polled everyone. And, we get a lot of these every year in terms of what we want to do. What do you want to see? What topics do you want to see? So when we polled everyone, these are the topics that came through. And a lot of them are general topics, but ocular disease was one that was pretty big this year. Fitting techniques was another one. And then AI, of course, is probably growing in popularity, and new technology trends. So we always try to cover all these topics, but you can imagine that it's hard to get into what does it actually mean from an education standpoint. So I want to make sure that next year is going to be again at the Horseshoe in 2025 if you didn't attend or if you haven't attended in the past. And you're going to find if you don't subscribe to Contact Lens today or that you will get upcoming promotional material on that and when to register, when the early bird registration is and all that. But I want to actually poll you guys again. So I'm going to go back to, hang on. Should have practiced this better. There we go. So what scleral lens topics are you interested in? So I want to hear from you. So you can click on scan the QR code. If you want, you can go to menti.com and you can click on this code. But I want to see what you guys are interested in. Sometimes it takes a little time. Fitting tips, troubleshooting, multifocals. I love it. HOA correction. It looks like multifocals is popular. I like it. Advanced customization, new technology, colored lenses. I like it. Front surface wetting. Building a patient base. So we did actually, and I didn't get to everything, but we did have a couple lectures on building a specialty lens practice, and then also teaming up with ophthalmology. So those were some great things. I just didn't have enough time to go over through everything. Post PK management. I like that one. Logistics. I would like to know more about that. Do you mean patient, how we operate the logistics of the exam room or logistics of your office? Topography. Love it. So I'm going to challenge you guys even more. What are some specific topics? So you mentioned scleral lens multifocal. So what do you want to know about that? You mentioned colored lenses. What do you want to know about that? Logistics, whoever said that, I want to hear more. So what are some specific things that you are just really not sure about when you're practicing and how we can help you? It's the first time I've used it. I think it's pretty fun. All right, occlusive scleral lens options. I love it. Limbal stem cell deficiency, cool. I did propose that topic. Deep dive in the fit of SM scleral myopia. Cosmetic tints, cool. Tracking corneal scarring, I like that. That's a really good one. That was talked about last year during the IFSLR presentation. That usually runs a little bit more be ahead of the GSLS. I'm challenging you guys. It's hard, right? It's hard to make decisions on these. More limbal stem cell, I like it. Displaced optics. Keratoconus, so probably talking more about those difficult fits, the more advanced fits. RGPs for corneal transplants. Yep, we can't forget about those lenses. Fun. Fitting over traps, definitely SJS. Yeah, definitely some more disease-specific topics are things that I would like to look at doing. All right, so I'm gonna go back to my presentation quickly. And let's go back to that one. So as I mentioned, so how do you get involved? So if you want to get involved in the future, first of all, I would encourage you to check out the April issue of Contact Lens Spectrum. That's where we actually write up all of the post-GSLS presentations and you'll have an opportunity to read more in depth about what I spoke about tonight. Contact Lens Today, if you're not subscribing to that, it is a weekly publication. e-newsletter. So that's a great area to get updates on the contact lens industry, but it's also where we post our events and what's happening with GSLS. If you want to get involved, look at those two, the contact lens spectrum and also the contact lens today. I try to post them on my social media, and so do many of us. Um, our early bird registration will come out probably in the summer. We always do a call for submissions for abstracts for the breakout sessions that I mentioned. And we also later in the fall do a request for poster submissions. So if you do want to get involved, I would really appreciate if you just look out for those things. I mentioned I'm not a big self-promoter, but I'm terrible at social media. I'll be honest with that. I do really try to post all of these things on my Instagram, which is the KD, the OD. You can check out. I hopefully try to post everything on LinkedIn as well. And if you have any questions about tonight, feel free to email me. I'm always just an email away. I'm happy to take any questions. So I think we made it.
Good job, Dr. DeLoss. That was fantastic. I totally took a screenshot of all the topics that people are interested in because that could be future webinars for us as well.
Yep.
Thank
Yep.
you so much. I relived GSLS in 50 minutes.
I tell you, and I apologize, if there's anybody watching tonight that I didn't get to your lectures, like I said, it was overwhelming to try to go through 3 days of
Sure.
education. So I did what I could, guys.
Totally understand. Well, I think you did such a great job. There are a few comments, mostly people saying you did a great job. Thank you so much, Dr. DeLoss. So I think we'll call it a night, unless you had any parting thoughts for before I wrap it up.
I think you probably share the same sentiments that we really try to bring good quality education as part
Right.
of the education panel for GSLS. We encourage to hear, we want feedback from you. We're here to educate you and bring the education to you. So if there's anything you want to hear about, let us know. We're happy to entertain and talk to you. We can't please everybody, but we
Mhm.
certainly try.
For sure. I mean, this is the audience that the GSLS meeting is appealing to for sure. So if you like these webinars, this is just a taste of what you can get at GSLS.